Let's talk about recovering from your procedure so you can appropriately plan it within your life, how long it takes to recover, what you should expect on certain days. So basically, from a look standpoint, you need to understand that you're going to have a bandage on your head after surgery. It's going to be a brown bandage. It's a little elastic. It's going to have a big bulky back to it. And you're going to have your normal hair on top with the grafts in place. And lastly, underneath that bandage is going to be a very short haircut if you didn't get the discrete procedure or concealed procedure, and little holes that will heal over time. So you're going to walk out of surgery essentially looking like that. You're going to take that bandage off in 2 days. In 2 days, what you're going to see is a very short haircut, unless you had a concealed procedure, healing little scabs, little speckles. You're going to see scabs where you put the hairs into, right? And you're going to see your normal hair. Now, a lot of times, if you have hair, we will have advised you on growing it out, and you'll be able to cover up the grafts with your hair. But if you have no hair on the top right now, we put grafts in place. Obviously, you'll see those little stubbles, right? So on day 2, you'll start seeing those. From days 2 to 7, you may have swelling. This is related to the fluid we place in your scalp to get you numb to your procedure. It's going to want to move down with gravity. And it's uncommon for people to get swelling in their face, but you might have it. If you do, you can have swelling, a little poofiness around the eyes, lasting up to 7 days. On day 10, you'll see me in the clinic after your procedure, as early as day 10. And we can wash out all those scabs, and all you'll be left with is a little bit of stubble of the hairs. The skin will be slightly red, but that'll subside over the next couple of days. Most likely, if you have hair, you'll be able to cover all those grafts. However, if you have no hair, you will see the little stubble. At 10 days, the hair tends to have grown out, and all the scabs have tended to heal. So I tell people at 10 days' time, you can essentially return to full-on frontal social situations. So for a lot of people who are in sales, you can be directly with clients, or attorneys who are client-facing. In between, for people who are not client-facing, you can wear a cap at 5 days. So at 5 days period of time, you can go on social events where you can wear a normal cap, and all people will do is see a short haircut on the sides. They will not see any scabs, will not see anything else. So you can actually go to normal social situations with the cap on in 5 days, but you can be full frontal facing with anybody around the 10-day mark, and they will not really notice. The caveat is if you have no hair whatsoever on the top, those little speckles of hair will be new and your skin will be slightly red. It can hold that reddish hue for another week or so. After that, everything looks relatively normal. Thinking about activity-wise after your procedure, now this is an investment. We're only telling you to reduce activity, not because you're going to feel like you need to. It's just because we want the grafts to heal. So at 5 days out from your procedure, you can sweat, but you can't strain. That means you can't raise your heart rate, you can't raise your blood pressure. That's because the blood vessels are forming to these grafts during those first 5 days, or first 10 days, and they're really, really weak. And if you raise your blood pressure or raise your heart rate, they can pop and they can eject the graft. Around 10 days period of time, you can actually sweat. You can moderately strain. What does moderate strain mean? Well, you can get your heart rate up, but you can't get your blood pressure up. So 10 to 15 reps in the gym, that is no struggle, is going to be just fine around the 10-day mark. Between 10 days and 2 weeks, we're going to see you in the clinic. And once we see you in the clinic, we're really going to jostle around these grafts. We're going to aggravate them, and we're going to see whether any of them bleed. If any of them bleed, it means that they're loosely integrated. I've not seen a bleeding graft for a long period of time. And once they pass that test, you can go back to your activities. In terms of products in your hair, a lot of people ask about hair products. At the up to 10-day mark, you're just following the normal protocol. It's using the shampoo and conditioner that we give you. At the 10-day mark, you are allowed to put products in your hair that you immediately wash out. So that means going back to your shampoo and your conditioner, but not putting products in like your mousse that's going to stay in your hair. That's going to be till the 2 to 3 week mark. And we'll sign off for that at your follow-up visit. For people who go through very strenuous physical activity in which the hairs can be hit, that's a boxing, wearing a helmet of sorts, we're going to not put any pressure on your hairs for 3 weeks. So wearing a helmet is 3 weeks out. And then doing anything where your hairs can get hit is going to be 6 weeks out. You can go back to haircuts after your procedure at day 10, as long as the blade is not on top of your skin. So if you're shaving your scalp or you're clipping it all the way down, you have to wait to the 6 week mark. But you can come into our office and have our barber go ahead and give you a buzz cut at day 10, or you can use a clipper guard at day 10 to cut your own hair. Hope that helps plan the procedure life. Rule of thumb, to say it's 10 days. If you can get 10 days off, have your procedure on a Friday, take the next week off, and the following week you're totally back normal. Otherwise, just know you can wear a cap at 5 days and get back into social situations with the cap on.